اتفضلوا حضراتكم في اماكنكم عشان هنبدا المحاضره. انا مع حضراتكم احمد عبد المعز، مدير المبيعات في شركه ايجيبت جروب، الوكيل الوحيد لشركه نورش لايف الامريكيه منتجات السبيك. الاول بنشكر الساده الاساتذه الاطباء الافاضل على حضورهم السيمينار، وان شاء الله يكون سيمينار ناجح بيكم معانا باذن الله رب العالمين. بيسعدنا في الاول ان احنا بنعلن عن اطلاق منتج جديد اللي هو منتج البيور اويل. ده منتج مميز جدا، ليه نفس الخصائص المميزه بتاعه السبيك سموث او السبيك تويست. بيضاف ليه كمان ان مضاف عليه فيتامين دي، وده من الحاجات اللي بتخلي النتيجه اسرع والاستجابه بتبقى احسن. كمان ده المنتج اهو اللي هو البيور اويل، ده شكل العلبه. في كمان منتج جديد بيطلق لاول مره برضو، هو منتج ليرن. ده منتج مميز جدا، بيبقى مناسب جدا في حالات ضعف التركيز اثناء الدراسه. ده شكل العبوه 60 كبسوله. ده سوفت جيل ايزي تو سوالو، منتج مميز جدا في مضاعفه تركيز الطفل في فتره الدراسه، لان زي ما حضراتكم عارفين التغذيه السيئه وعدم حصول الطفل على الحصه المناسبه من وجبات الاسماك شهريا دي نوعا ما اللي بتعمل له مشاكل في ضعف التركيز في الدراسه. ان شاء الله هنبدا السيمينار حالا مع محاضره للدكتور ديفيد دورنفيلد. بعد المحاضره الدكتور ديفيد هيخصص وقت للتفاعل لو في تساؤلات سواء في موضوع المحاضره او في خارج موضوع المحاضره. بعد كده يبقى عندنا كوفي بريك سريع لمده من 10 ل 15 دقيقه. بعد ما نرجع من الكوفي بريك هيبقى في محاضره للاستاذه الدكتوره نجوى عبد المجيد. بعد كده عندنا محاضره للاستاذ الدكتور ايهاب عيد. وبعد كده عندنا فقره شيقه جدا عن الفن الاورجاني، ان شاء الله نتمنى تعجبكم باذن الله رب العالمين. اخيرا هيبقى عندنا الغداء اوبن بوفيه ان شاء الله بعد انتهاء فقرات السيمينار كلها. Thank you Dr. David for attending our seminar and kindly start the lecture now.
Good afternoon, everybody. Thank you so much for this kind honor. I first want to thank the Egypt Group for inviting me, as well as Nurse Life for inviting me to speak in front of you. I'm a clinician. I'm a family practitioner since 1986 in Middletown, New Jersey. Can everybody hear me fairly well? Okay. I will try to speak a little slower because, believe me, my Egyptian is much worse than your English understanding. And I will try to make this as interesting as possible from a clinical point of view, because that's what I do. I'm not a scientist. I'd like to know from the audience what kind of specialties we have here. So the pediatricians, we have how many pediatricians? And psychiatrists, and neurologists, and therapists. Sorry? Phoniatricians, speech language, excellent. Pediatrics, internal medicine, child mental health, fantastic. Many family practitioners as well. Anybody have children of their own on the autism spectrum? Wow, you go to American conferences and most of the physicians in the audience, the reason why they go into autism work is because they themselves have autistic children. And it's beautiful to see you, like myself, who do not have any children on the spectrum, that are here to try to learn about how to take care of kids on the spectrum. In 1994, I started doing integrative medicine, where instead of doing traditional medicine, I tried to learn to think outside the box. And I joined a group called ACAM, that's the American College for the Advancement of Medicine. And they had various lectures to try to tell you how to do natural hormone replacement therapy and to balance the thyroid and to learn how the environment plays a huge role in learning how to detoxify the environment. And after doing this for a number of years, one of the speakers there, his name is Kenneth Bach, who has written a number of papers on autism and books on that topic, said, you folks in the audience need to learn about how to take care of children on the spectrum. And me, I saw one autistic child in 1983, and that was so few and far between in the United States. And unfortunately, as we know, we have a huge pandemic of this disorder, not because we're better at diagnosing it, but because it's becoming more and more predominant in our society. If it was that we're better off in diagnosing it, where are the 30 and 40-year-old autistic kids, adults? We don't see that. We see 4-year-olds and 3-year-olds and 2-year-olds starting to show signs early on. So I don't believe it is so much a better that we're diagnosing it. Yes, we're better at diagnosing it earlier, but I believe it's a big problem with how the environment is playing a big role and various other methods. And I will speak to you, hopefully clinically, that you can take home and work with your practice on things that I've learned from the specialists that I've worked with in the United States and around the world. By going to these conferences, Ken would say a number of times, please go to an autism conference and learn how to take care of these people, especially the children. So I went to my first autism conference. At that point, it was Defeat Autism Now in Washington, D.C. And now it's transgressed, it's improved now to a company called MAPS, which is the Medical Academy of Pediatric Special Needs. That's a fantastic training group for physicians that happens twice a year. The next one is going to be in September in Orlando. So if anybody wants to really learn the nuts and bolts of a biomedical approach as well as a scientific approach and what can be done to help mitochondrial dysfunction and help with improvement of autistic behaviors, then going to March to MAPS is a fantastic conference. But when I went there, I was sitting in the audience for the first lecture was Betty Lowe Fisher, and she spoke about how her son received a DPT vaccine and became changed the day after, and wrote a book called A Shot in the Dark. And I'm sitting in the audience, a physician who knows to give DPT is so important that this actually could have caused the problem. And the next lecture was by Stephanie Cave, who talked about another group of combinations of vaccines may be implicated in that environmental insult. And vaccines is not the only reason, and you know, there's so many reasons why we have this problem. But she gave me this talk that just made me so choked up that we as physicians could be giving somebody a foreign object, these adjuvants, this mercury, this aluminum, the formaldehyde that we're putting in this vaccine. Is that causing some of the behaviors we're seeing? And then we had a little pause between the first speaker and the second speaker and the third. And this lady next to me is looking at me as a parent and sees that I have a physician badge. And I could talk to anybody, so I just started a conversation. Do you have children? How many kids do you have? She had 2 children on the spectrum. And we were talking about them a little bit, and she asked me, do I have anybody on the spectrum? And I said, no. And then she, like, with tears in her eyes, was saying, well, why are you here? And I said, I guess I'm here to take care of people like you. And that moment changed my life. And I've really gotten into the point that I need to learn how to take care of autistic children and find ways of using all the modalities I've learned prior and now since then to improve the human frame, if you will, and start at very young. So when I try to give talks around the country on autism, I predominantly feel that a great component of not just autism, because I'm a family practitioner, I take care of 98-year-olds and I take care of 2-year-olds, but a predominance of the disease states we have can be related to how the environment plays a big role. And I'm sure you see this throughout the world itself. But I appreciate the opportunity to come to Egypt. I was visiting here 5 years ago with my parents at the time, and my father has so many ship signs all over when we were visiting here. It's a beautiful country, and I'm honored to be amongst you today. So again, I say thank you, and I believe it's shukran. That's the extent of my Arabic. But my goal is I try to practice every single day in my medical practice, as well as my life, is to keep our diet and environment as toxin-free as possible in order to promote the quality of life and prevent disease. You know, they say that the genes load the gun and the environment pulls the trigger in this disease. Well, the environment, is it the GMOs, is it the pesticides, is it the electromagnetic frequencies, is it just the vaccines or the adjuvants, or all these different components, which I'll show you the environmental load a little bit later on, are they all contributing to this disease? And if that's the case, how can we improve the human frame? You know, if we can look at how to help various methods, then it would be really helpful. So I like to use an integrative approach. when treating anybody, but especially for autism. And I do a lot of work with hyperbaric oxygen therapy, mild hyperbarics, which we'll talk a little bit about, and I do chelation therapy, and I do nutritional basing management, and how to improve with detoxification. And we're going to try to see how we can improve by a number of these modalities to turn the child around. I call it a powerful combination in autism spectrums and beyond. Thomas Edison, the famous quote that he has, and we try to do this every day: the doctors of the future will give no medicine, but interest his patients in the care of the human frame, in diet, and the cause and prevention of disease. Cause and prevention of disease. Not just put a Band-Aid on it, let's take care of why did this occur and prevent it from recurring. If we have the opportunity to go to a cleaning station like this hawksbill turtle went to, and this is a cleaning station that if you do scuba diving at all, you will realize that there's places that fish go to that they can go and get various therapists. We have the physical therapist, we have the occupational therapist, the speech therapist, the phonetics professor, psychiatrist. We have all these different helpers. Just for your knowledge, this fish is called the doctor fish. So there's only one doctor fish, and usually these are all the therapists that are needed to help in an autistic person. Because we can't just say that there's only one way of doing things. We need to have a holistic approach. So when we have the opportunity to go to a cleaning station, life would be wonderful, but unfortunately, we have to have groups like this to teach physicians and to work with them in order to get the job taken care of. So from aging to autism, you need to look at a little more holistically as to what can we do to balance the human frame. So when you look at thyroid disease, for example, it's not just looking at your T4 and your TSH, or your free T4 and TSH, but if you don't consider can a person can go T4 to T3, then you can find out T3 is the active component. You need to make sure the person can have a proper improvement of their T3 balance. In the United States, most doctors just look at free T4 and TSH, and they don't balance it with T3. Well, you look at gastrointestinal disorders, no one looks at bioavailability of biofilms or malabsorption issues to the degree they need to. So when you're looking at trying to holistically treat somebody, you need to think about from cardiovascular to pulmonary to neurologic, and especially in autism. We need to think a little more holistically. What is causing the negatives? Not just take a statin and control your heart disease. You need to really see how this works. We need to enhance the circulation. We need to reduce the nerve inflammation, and that will really heal some of the tissues. Brain processing and speech development, ADHD reduction will improve. And through diet, detoxification, especially with chelation therapy and other oral agents to help in that regard, hyperbaric oxygenation enhances the immune system's ability to fight off these issues. If we had a world that was like this, if we wouldn't have a problem with this disease. We have really clean air, fresh water. Is there any way of lowering the lights just a little bit on the slides?
Okay.
If that's possible. Thank you. This is a beautiful scene out there in the Utah desert. Really beautiful, clean water. This is nice, rich flora and fauna, and no pollution. We don't have that, unfortunately, in our world. And in the United States, we have a lot of problems in this regard, as we do around the world. We have pollution. We have chemicals. We have unbelievable amounts of problems with our environment. There's been a study through the Environmental Working Group that babies can be born. They did a study with 1994 of neonates. That's 10 children were evaluated randomly, and they had over 287 chemicals in the umbilical cord of the child. So these kids are being brought into this world with a whole host of problems, and we have to be aware of that. Oxidative stress and inflammation contribute to many diseases. If you look at, this is Time magazine came out, and I believe this is 2004, a surprising link between inflammation, heart attack, cancer, Alzheimer's, and other disease. How can you fight it? Well, inflammation is the root of all evil. We all have a throat. It doesn't bother us until it has an itis next to it. It becomes pharyngitis. We have gastrointestinal disorder. If we have a colon problem, we have now colitis. Inflammation of the joint, arthritis. Inflammation of the various diseases can be improved upon when we knock down these inflammatory markers. And what can cause inflammation is a whole host of problems. But when you look at the main component of most of these diseases, heart disease, Alzheimer's, allergies, arthritis, multiple sclerosis and Parkinson's, Crohn's disease, chronic fatigue syndrome, autism, ASD, and we use autism, naturally you all know it's autism is a broad topic for Asperger's disease, Asperger's syndrome, and PDD and OS. But if you look at ADD, ADHD, it's very similar in biochemistry to this as well. Cancer is an inflammatory disease, autoimmune disorders, memory loss, diabetes, Lyme disease, something we have a terrible amount of problems with in New Jersey and in the East Coast. You probably have some Lyme disease here as well, maybe not as much, but it's a very poorly diagnosed item. I will spend a few minutes talking about Lyme disease because it is another one of these epidemics that's going to become a problem to people who visit your country, as well as there have been actually studies of tick-borne disease and even some of the mummies from back in the earlier days. There was a study that came out of the Journal of Environmental Health in 2008 that showed industrial air pollution may increase the risk of autism by up to 50% in young children and unborn babies. You're putting styrene gas and you're putting other bad gases into that child and to yourself, and they don't have the capability of getting rid of that, especially if they have like an MTH of SNP, or if they have other genetic polymorphisms that cause problems for detoxification. So you want to just look at all the details. We can't live in a smaller world and avoid all this, but if you can try to reduce the GMOs, the pesticides, and some of these other environmental triggers, we may end up with a much better healthy life. Mount Sinai came up with the leading 10 toxic substances suspected in autism. Number 1 is lead. Anybody watched the news this morning? They talked about I think it's called Mati, is a product that is in India. Prepared foods come together, and you can open up and prepared food, just add water to it. Mati, I think, is the name of the company. They found out there's tons of lead inside of it, or a large volume of lead. They want to rip it off the markets because it's been around for 80% of the fast food, prepackaged foods in India coming from a company called Mati. And they decided today in the news that they're going to take off the market because they've discovered there's too much lead. You know, if you look at Centrum vitamins in the United States, there's lead in that too. But they don't advertise there's lead in it. There's a lot of underlying problems in our world with lead. It's in the solder of the pipes, the copper pipes that go into your house. It's in paint, and I'll go into it in greater detail further down. Methylmercury is a huge toxic substance. PCBs, organic phosphates, pesticides, other organochlorine pesticides, etc. You can read this list, but brominated flame retardants is huge. We have a problem in this world with hypothyroidism, at least in the United States. There's a lot of people finding more and more thyroid disorders, and we have a lot of thyroid disorder in the autistic population as well. Why is that, do you think? Well, we all sit around and say, okay, I remember my periodic chart. My periodic chart shows that iodine, the most important item that we have for thyroid disease, is located in the same column with other competitors that we have a lot of. We have competitors in fluoride, and in chlorine, and in bromide. And all three of those markedly impede our ability to use iodine so that our thyroid functions. So when these other components are present in our environment, our body can't make iodine work so well, or competes with it, and that causes hypothyroidism. So you have to think a little bit differently than we're taught in med school or without your training, that it's not just one or two things that cause a problem. It's additively leading to the effect, and the effect is unfortunately being seen in our children, the ones who have the least immune system. What happens with the environmental frequencies? Does that play a role? We have a problem in the United States as well. There's not a lot of bees, there's not a lot of butterflies anymore. And it's because of the EMFs, the cell phone towers, from everything that you can consider. We want to think